Well, my interest is in critical care of cirrhotic patients, and so I was inspired to do the study trying to look at ways that we can intervene on patients who are in the ICU in order to improve outcomes, and then secondarily in an effort to identify patients who are at highest risk for mortality or increased length of stay in order to better allocate our critical care resources to patients that are at number one, highest risk for mortality, but also the patients who are at highest risk for doing well in the ICU. Hepato-adrenal syndrome is a clinical entity that was first described in 2005, and since then there's been very little research done in the area. Patients with cirrhosis commonly have hypotension, and I think it's under-recognized that the elevated levels of endotoxin and low levels of lipoprotein circulating in patients with cirrhosis can lead to adrenal cortical dysfunction. In 2005, the defining paper defined hepatoadrenal syndrome as a random cortisol level less than 15 in patients who were highly stressed in the ICU, specifically with respiratory failure or hypotension. In patients not in the ICU highly stressed, a random cortisol level would meet criteria less than 20. Secondarily, they looked at patients with ACTH stim testing, and a patient with HAS would meet criteria if they had a 30-minute post-test random cortisol level, not random cortisol level, of less than 20. So we looked at our population of patients who were in the ICU at Cleveland Clinic from 2008 to 2014. We had almost 500 patients, and of those patients, 69 met criteria for hepatoadrenal syndrome. This is a population composed of both patients with cirrhosis and acute liver failure. We looked at both mortality and in-hospital mortality and ICU and hospital length of stay. A little surprisingly, patients with hepatoadrenal syndrome did not have a higher mortality, in-hospital mortality, but we didn't look at outcomes such as 90-day or one-year mortality. That would be something interesting to look at. We did look at ICU and hospital length of stay, and patients with hepatoadrenal syndrome did have both longer ICU and hospital length of stay. The average length of stay for patients with hepatoadrenal syndrome was 6 days in the ICU, whereas it was closer to 3 for patients without hepatoadrenal syndrome. It was upwards of 26 days for hospital length of stay for patients with hepatoadrenal syndrome compared to 16 for patients without hepatoadrenal syndrome. In our next arm, we're looking at the treatment for these patients to see who was treated with glucocorticoids for what duration in an effort to define what the optimal treatment regimen is for these patients. That hasn't been defined, and there is no guideline on this topic.